Welcome to the Healthcare Payment and Revenue Integrity South Speaker Interview Series, where I, Lydia Toth, the producer of this upcoming event, will have the pleasure of interviewing some of our esteemed speakers. I'm currently joined by Dr. Deepak, the Executive Medical Director of Revenue Cycle and Supply Chain at Monument Health, who will be one of the two speakers presenting the talk titled Clinical Integrated Revenue Cycle at our event in February. Hi, Deepak.
Hi, Lydia. Morning.
So my first question for you would be that can you briefly explain what your presentation at our event will be about?
So, Lydia, I think I'll start with a story that, we had a 19-year-old young lady coming to our hospital for healthcare needs, and those healthcare needs was surgical in nature, would be very expensive. And our healthcare system almost bankrupted this lady before she earned her first dollar. And this was a good driver for us at that point of time to talk about that, what are we missing? The patient is expecting full health care from us, that we would meet her needs. Doctor wanted things done. Insurance companies had their driver that they wanted to save money, and somehow this patient almost fell through cracks, but it was a big driver for us to work through things. We got this patient eventually the services, but we also started on a journey that where we connect our clinical providers, our clinical operations, our revenue cycle, and the whole system, the payer system together. How do we bring them together? That has been a big, I think, success for us, and that's what we would like to share with others. If it helps provide better patient care in the respective realms, and that would be the topic of our talk.
Thank you for sharing that story and that mission. So moving on, what would you say is the biggest challenge that has to be overcome when looking to improve collaboration between health plans and providers?
There are quite a few challenges in this, I would say, industry as they are growing as well, because the knowledge and the information in the payer industry, the systems that are being put into place, they're growing exponentially. And that knowledge has to go to the providers, and that is not being kept in sync at this point of time. The providers are not being kept aware of this knowledge, and what people do when the knowledge is overwhelming, they just throw up their hands in the air and say that I'm done with this. And I think this is what is happening, and in the end I think it's affecting our patients, it's affecting patient care, and probably deteriorating the quality of care and also increasing the cost of care. So health industry in general, I think, is taking a loss, and the worst the people who are receiving the worst of this are our patients. And that has been, I think, our biggest hurdle. And this is also the journey that we are on, to create a good platform that how can this information be shared back and forth, and the system could be a system that can have win-win situations.
Mhm. That makes sense. Um, and we hope to address this at our event as well. So what aspect of the upcoming event are you the most excited for?
So I'm actually looking forward to meet the industry leaders and also hear their perspectives in this realm, because what we see in from the hospital and healthcare delivery standpoint of view is our providers' perspective, revenue cycle perspective, operations perspective, and we are very sure that payers are also facing some challenges. How do we solve problems together? Because this is unsustainable. This is not gonna lead to good patient care in the future. And to be honest, a lot of people in this industry are very pessimistic about healthcare, and it should not be so. And I'm looking forward to hear ideas, thoughts from other leaders. How can we make it better for everybody?
I hope so too. Well, thank you so much for taking the time to share your insights and your mission and your stories. And I really hope to meet you in person in Miami at the conference.
Thank you, Lydia. Same here.